Hello learners, welcome to this online session. Today we will be talking about nutritional status assessment. This is part of the certificate program in food and nutrition. The course is your food and its utilization, second course, and block 5, unit 15. I'm your program coordinator, Professor Deeksha Kapoor from the discipline of Nutritional Sciences, Indira Gandhi National Open University. Well learners, you have now good understanding about what will compromise an adequate diet. Adequate nutrition will meet our body needs, and you would notice that when you are in a state of good nutrition, you will look and feel good. You will have a healthy complexion, bright eyes, good figure, positive, happy temperament. There will be a willingness to carry on the day-to-day activities, and such an individual will be productive, will be an asset to the family and community. So, how do I know that I am maintaining good nutritional status? Well, this lecture therefore will focus on the concept and the measures we can use to assess nutritional status. We will look at the different methods, anthropometry as a tool to assess nutritional status, the various measures within anthropometry. We will look at growth monitoring for children and then move on to the clinical method, biochemical, and the dietary assessment method as tools to assess nutritional status. So, let us begin by looking at what is nutritional status. By now, it must be clear to you that the state of health of an individual, as it is influenced by the intake and utilization of nutrients. We have different nutrients, and what happens to those nutrients in the body when we take them in adequate amount or we do not take them in adequate amount. The state of health is the nutritional status. Therefore, nutritional status gives us the level of nourishment of the body. Okay, so how do we know that I am in good state of nourishment? There are simple methods which have been provided. They are called the direct methods of nutritional assessment, and they include anthropometric measurement, biochemical method of assessment, clinical examination, and dietary assessment. Today we will focus on each one of these methods separately. Starting with the anthropometric methods. Anthropometry is the measurement of human body at various ages and the level of nutritional status. So, what do we measure? When we talk about measurement of human body, we are talking about body weight, we are talking about height, we are talking about mid-upper arm circumference, body fat measurements, and head and chest circumference. Let us start with the body weight, but before I move on to that, it is also important to understand that anthropometric measurements depend on accurate age assessment as well. Why? We will just see. So, when I am talking about assessing the body weight as an anthropometric measure, what do we do when I am taking the body weight? It is actually an indicator of body size. Therefore, serial measurement of body weight is a very sensitive indicator of changes in nutritional status. We get to know whether the body is growing or increasing in size or not. Any rapid loss in body weight, therefore, is indicator of potential malnutrition. As you would have noticed that day-to-day changes in your dietary intake can reflect on your weight. So, it is indicative of short-term malnutrition. particularly in case of children, 1 day, 2 day deprivation of diet will result in loss of body weight, which will give us an indication of short-term malnutrition. How do we measure weight? There can be different weighing instruments. You may have seen the beam or the liver scale in the hospitals, clinics. You may have seen that in the government programs. There we use the Salter weighing scales, or at home you may be using the bathroom scales or the digital weighing scales available. You can use them, standardize them and use them for taking the body weight. Let us look at height as the second anthropometric measurement. When we talk of height or length, it reflects the total increase in the size of the body of an individual up to the moment we are determining it. Of course, height is influenced by genetic or hereditary factors, but the environmental factors too influence. Genetics will give you the potential, will give you the potential to grow. However, it is the nutrition which will help decide whether you can achieve that maximum potential or not. Therefore, nutrition plays a very important role, and height is affected by long-term nutritional deprivation. Unlike weight, where short-term deprivations can be seen, height is affected by chronic malnutrition. Inadequate diets over a long period of time will influence the height. How do you measure height or length? In fact, we measure length in case of children under 2 years of age. So we use an instrument called infantometer, and we measure the crown heel length. The child is made to lie on that infantometer, and from the crown till the heel, the length is measured. But we measure the height for individuals 2 years and above. You can use a portable anthropometric rod or a simple measuring tape against the wall. The child may be made to stand, or an individual, and we can measure the height. What do these three indices we've just talked about, age, height and weight, how do they reflect then the nutritional status? We know the weight, we know the height, and I have said that age assessment is also very important. How do height, weight reflect the nutritional status? If the weight of the child is low for the age, we have standards which are available. The World Health Organization has given growth standards for children. If the weight of a particular child is low for that age, that child is categorized as underweight. If the height of the child is lower than the standard height, it is called stunting. And when the weight of the child as compared to the height, the weight for height is lower than the reference value, we call such a child as wasted or thin. Therefore, we use the weight or the height along with the age as a measure to assess whether the child is underweight, stunted or wasted. Other measure used is the body mass index, about which you have already learned earlier in block 2. BMI you learned is the ratio of weight to the square of the height in meters. You calculate the BMI, and then the World Health Organization has already given you the classification. So if your BMI is between the range of 18.5 to 22.9, the Asian cutoff for normal BMI, you maintain good nutritional status. For children, we know that BMI for age is the index of assessing nutritional status. Moving further, how do we use assess the nutritional state of children based on BMI for age. As you can see here, if a child has normal height and a normal BMI, we consider the child as normal. But you would notice that a wasted child will have a normal height but a low BMI. On the other hand, a short child will have a short height and a normal BMI, whereas a short and a wasted child will have a short height, will be stunted, as well as a lower BMI. So, by looking at the height, the BMI, we can assess the nutritional status of the child. Moving further to the second or the other measure we talked about was the mid-upper arm circumference. What does it indicate? The MUAC indicates the size of the arm muscle and the fat layer below the skin. Well, it is more feasible to assess MUAC because it is not age or gender specific. In a community setting where it may be very difficult to assess the age of the child, so for all children under 5 years of age, just measuring the mid-upper arm circumference will help determine the mortality risk or the nutritional status of that child, particularly in emergency situations where we may not have the instruments required for height and weight. How do you measure MUAC? Basically, you can use any flexible fiberglass tape to measure the mid-upper arm circumference. As you can see, it is the measurement taken on the arm while hanging freely on side of the body at a midpoint as seen. You can use that flexible fiberglass tape, any available, or in field situations, these tapes, the red, yellow, green tapes can also be used, and you measure the arm circumference. If you are using a flexible fiberglass tape, we will look at what the reading will show us. But if you are using this red, yellow, green tape, when you put it across the arm, if the red part comes and matches the red part, you are undernourished or you are suffering from malnutrition. If you are taking the measurement in terms of centimeters, the flexible tape around, and if your arm circumference is more, this particularly is used in the case of children. So, if the circumference of the child is more than 13.5 centimeters, it is normal. Measurement less than 12.5 centimeters is indicative of severely malnourished and requires immediate attention. Moving further, the next measurement is the head and chest circumference. This too is usually used among children. You will notice that the head circumference is taken. You can use a flexible glass tape or any plastic tape, and passing the tape around the head will help measure the head circumference. Similarly, the chest circumference is taken at the nipple level, preferably in mid-inspiration stage, and you can get the chest circumference. What do these indicate? Basically, the head circumference relates to the size of the brain. The head circumference continues to increase rapidly up to 6 months because, as you know, the brain development is taking place after birth. Then after 6 months, the head circumference increases slowly, but the chest circumference usually measures the growth up to 3 years. So, if you take the head and the chest circumference at 6 months, the standard values have been presented here. If you look at 6 months, the head and chest circumference almost equal. Thereafter, During second and third year of life, the chest grows at a faster rate than the head circumference. So, the head and the chest ratio is useful to detect undernutrition, and particularly we use it in early childhood only. The next measurement is the skin fold thickness. This measures the fat located just underneath the skin. So, basically it gives us a measure of the extent of body fat reserve in our body. So, insufficient intake of calories in our diet will result in the reduction in the thickness of fat layer under the skin. So, measuring of the thickness of fat under the skin, how do you measure it? There are skin fold calipers, as you can see. These calipers can measure the fat layer under the skin. You can measure at the back of the upper arm as shown in the figure. You can use the front of the upper arm. There you can measure the thickness of the fat layer, or you can use it below the shoulder blade. So, skin fold calipers are used to measure the extent of body's fat reserve. So, what we learned so far was mainly linked to the measures we can use to assess nutritional status, particularly the anthropometric measurements. So, once you have the body weight and height, even in case of adults we can use it to assess their body size or the nutritional status. And you've already learnt about the body mass index as a measure to assess malnutrition earlier in block 2. So, yes, using the body weight and height, we can assess the BMI and compare our BMI with the standard values. If our BMI is within the normal range of 18.5 to 22.9, we maintain good nutritional status. For adults, waist and hip circumference measurements also are indicative of abdominal obesity. So, a waist to hip ratio more than 1 for men is indicative of abdominal obesity, and for women value more than 0.85, and abdominal obesity is linked with many grave heart conditions or disease conditions. Therefore, we need to avoid abdominal obesity. So, this is about how we measure nutritional status of adult. One thing here I need to emphasize is using growth monitoring of children as a means to assess nutritional status. With the height and weight which we are taking, serial measurements of weight and height will help us monitor the growth of the child. And with the help of growth charts, we can visualize the growth of the child once these measurements are plotted on these growth charts. The World Health Organization has given us the growth charts using the standard weight and height for children. So, here is a growth chart. The normal growth trajectory is the curve going upwards. If a child is growing properly, so serial measurement for children during the first year of life, every 3 months a weight needs to be taken and plotted. In fact, for children under 6 months of age, it would be helpful to take the weight more frequently, and then plotting the weight as per their age onto the growth chart, you will see the direction of growth. A movement of the growth or the trajectory going upwards is indicative of good health. So, serial measurements taken at frequent intervals show that the child is growing normally. These growth charts are very useful in situations where the mothers may not be literate or illiteracy is high. There, these charts can be shown to show the growth of their child. Similarly, height can be used as a measure to assess the nutritional status. Let us next move on to the next anthropometric measure, biochemical. You can remember these methods as A, B, C, D. A stands for anthropometry. So now we start with B, which is biochemical assessment. What do we do in biochemical assessment? Here, we measure the level of essential dietary constituents, that is, the nutrient concentration which is present in the body fluids. Body fluids like the blood, in the urine, and measuring the nutrient content in the blood or the urine is helpful in evaluating the possibility of malnutrition. So, to help you understand, for example, we talked about protein energy malnutrition or vitamin A deficiency earlier in block 2. We talked about the nutrient deficiency disorders. How can we assess? By measuring the level of the nutrient in the blood or the urine. In case of protein energy malnutrition, we can measure the serum albumin levels, and a level less than 2.8 grams per 100 ml of serum or blood is indicative of high risk of protein energy malnutrition. We talked about anthropometry earlier, where low weight for height, low height for weight is indicative of malnutrition, particularly protein energy malnutrition, the subclinical forms. Likewise, biochemical assessment is more reliable. It will confirm the diagnosis. Similarly, for vitamin A status, we use serum vitamin A level in the blood. We assess vitamin A levels. A value less than 20 microgram per deciliter will be indicative of high risk of vitamin A deficiency. Anemia, we learned, leads to low hemoglobin levels. So, hemoglobin cutoffs are given. I am suffering from iron deficiency anemia. Likewise, the cutoffs are given for children, for pregnant women. So, we need to assess the hemoglobin level in the blood, and we can then classify individuals into different grades of anemia. Likewise, iodine deficiency, severe iodine deficiency, we can assess by looking at the urine iodine concentration, the median urine iodine concentration, and a value less than 20 micrograms per liter is indicative of severe iodine deficiency. These are confirmatory tests. So, biochemical assessment. Let us move to the next, which is clinical assessment, the third method. Clinical assessment, as the name suggests, is changes in the body as reflected by the signs and symptoms which appear due to deficiency of a nutrient. This is indicative of malnutrition. And usually, along with anthropometry, clinical assessment or assessment of these signs symptoms are important features of nutritional survey. It is simple, most practical method of asserting the nutritional status of individuals, but it requires experienced hands or trained workforce to be able to identify these symptoms, signs and symptoms. What are these signs and symptoms? You've already studied some of them in block 2 when we were talking about the deficiency disorders. We talked about kwashiorkor, and we talked about hair changes. We talked about discoloration of hair, sparseness, lack of luster. These signs, symptoms related to the hair can give us an indication of protein, energy, malnutrition in children. Moon face, we talked about puffiness, we talked about water accumulated in the body. This is a sign of undernutrition. Eyes, we talked about vitamin A deficiency, we talked about beta spots, night blindness, not being able to look or inability to see in dim light. These are the eyes symptoms which we can look for to confirm vitamin A deficiency. Lips, lesions or cracks appearing on both the sides of the mouth, what we call as angular stomatitis. There will be lesions, the lips will become cracked and become red. These are the deficiency symptoms for vitamin B complex vitamin deficiencies. The tongue can be assessed, and it can give us good idea about the nutritional status. Red raw color, very painful, magenta tongue can be an indication of malnutrition. Teeth, mottled enamel, not only the lack of a nutrient, excess of a nutrient can also be harmful, like in the case of fluorosis, excess fluoride in the diet from the water can harm the teeth. Deficiency of vitamin C is reflected by bleeding gums, spongy gums. This can be observed and a clinical sign for vitamin C deficiency. We have already talked about goiter, the enlargement of the thyroid gland in case of iodine deficiency. So, these are some of the clinical signs, symptoms we can look for to assess the nutritional status. Similarly, for skin, dermatitis or on the exposure to sun, when there are these lesions as you see in pellagra, which is niacin deficiency. These are all indicative of deficiencies, which signs, symptoms we need to be trained to look for when we are talking about clinical assessment of nutritional status. Nails, skeletal system, in case of vitamin D deficiency, bowed legs we talked about. In case of anemia, brittle and spoon shaped nails. These are signs, symptoms for malnutrition or deficiency symptoms. So, clinical signs are important. Last, let us look at the dietary assessment. What is dietary assessment? It is a simple systematic inquiry into the food supplies and food intake, food consumption of individuals and population groups. There can be a qualitative diet survey or a quantitative diet survey. These can be the two methods. Under the qualitative, we can have a food frequency method, where we may look at the frequency of certain food groups which are eaten or consumed by individual groups. But to get more meaningful ideas or estimates, we use the individual dietary intake. Within that, there can be various methods like the diet history method, food diary method, the weighment method, where we weigh what the individual is eating in each meal. But the most common one is the 24-hour recall method of dietary assessment. You would realize that in most surveys, this is the uniquely or the most commonly used method. A 3-day 24-hour diet recall is commonly used, where 2 working days and 1 holiday, because 1 day may not be representative of your actual food intake. So, a 3-day recall is ideal, where you as a trained person can ask your subject to recall all food and drinks taken in the previous 24 hours, starting from the first meal, bed tea, moving on to your breakfast, mid-afternoon or mid-morning, then lunch, then mid-afternoon, tea time, dinner time, bedtime. So, recording of what the individual ate in terms of the amounts also. This can then be noted and recorded. Of course, it depends on short term memory, but it can be representative of the person's usual intake. Then how do you evaluate it? You check the food intake with the recommendations. You have the nutrient intake recommendations given by the ICMR for each specific age group. Check the food, we calculate the nutrients and compare it with standards. We compare it with balanced diets to evaluate whether the diet is adequate or not. So, with this we end our session of assessment of nutritional status using anthropometry, biochemical methods, clinical methods and dietary assessment. Thank you.